New COVID research study out of Florida is confirming what many of us suspected in the early days of the pandemic. Essential workers, specifically low-wage workers on the front lines who may have not had the privilege of working from home, had a death rate of 5 times higher than those who did. That study yielded 2 big takeaways: that essential workers need more protections during an infectious disease pandemic, and that society's desire to, quote, return to normal will mean different things for different people with inequitable consequences. And that feels important to highlight as the U.S. continues to average 110,000 cases of COVID-19 every single day, while continuing also to loosen COVID restrictions. Joining me now, MSNBC medical contributor, Dr. Ujay Blackstock. She's the founder and CEO of Advancing Health Equity, literally the perfect person to talk about this study. So COVID impacted everyone, but not in the same way. I mean, help us understand this new data and what it tells us about how COVID impacted the American people in different ways.
Well, Zerlina, thank you so much for having me. And I feel like, we've had these kind of conversations over the course of the pandemic where we've talked about who is most vulnerable, who's most marginalized, who is going to be most impacted by the pandemic. And surprise, surprise, it is essential workers and service workers, people who are in low wage jobs who may not have health insurance or paid sick leave. So they're not able, as you mentioned, to stay home safely, but also the environments that they work in are especially high risk. And we don't have workplace protection. So we don't have standards about personal protective equipment for workplaces or standards around air filtration and ventilation. That is what we need. And so if we're going to have that push to normal, we have to make sure that we have workplaces that are equitable in terms of safety. And we're not there yet.
What would it look like? I mean, what would a list of policies look like if your company was thinking about equity?
Right. And what's interesting is that, we keep comparing ourselves to Europe. And I always say we can't compare ourselves to Europe because Europe has a safety net for its citizens. It has paid sick leave. It has health insurance. But I think also in terms of workplaces, people should not have to pay out of pocket for personal protective equipment. The mask should be offered for free by employers, right? We should make sure that there are a set of OSHA guidelines with respect to workplaces. So what is a safe workplace? What does that mean in terms of air being filtered or air exchange, per second or per minute? So we need specific data, and also in terms of vaccination requirements as well. That has fallen to the wayside, but we know that even though these subvariants are becoming more contagious and transmissible, we know that vaccines to some degree also prevent forward transmission of infection. So I think that there are so many different areas in terms of PPE, vaccination requirements. Air is another area, as I mentioned, that really needs to be focused on that we haven't. We always talk about you would never use someone else's bathwater, right? But we also, we use other people's air. We breathe in and out the same air. That is an area where we can invest resources and funding into improving the infrastructure.
That is a really scary example, using someone else's dirty bathwater. I'm going to think about that all weekend. The Biden administration announced Friday that it's getting rid of the testing requirement for international travelers coming into the U.S. I mean, to your point about the loosening of some of these restrictions instead of putting them in place so that we can mitigate spread. I mean, we're averaging 110,000 cases every single day. And as Dr. Siren Madad taught me, those deaths are in motion. Once the cases start, the deaths are in motion. What can we learn in terms of what it means about the future of this pandemic? What does it mean that some of these mandates and requirements are going away?
Right. And so, Zerlina, I think, we can stop beating around the bush and just admit that there are political and financial incentives for sort of repealing and lifting these COVID protections. So that is what it is. And basically, the administration wants to increase international tourism back to the U.S. So that is an economic issue. What I will say is that economic, change in policy is going to have implications. And it's going to have implications for the group we were just talking about, the most marginalized people who are essential and service workers who are going to be essentially exposed to the virus, and they're going to be highest at risk. And, it's like we keep repeating ourselves. We're not learning anything from 2020. We're not learning anything at all that impacts policy. And so I'm worried that that's going to mean more people suffering, more people hospitalized, and more deaths, unfortunately, in this pandemic.
I wish we weren't a broken record. Was that a reference that makes me sound old? I don't know, but I wish that people would learn from these previous 2 years of the pandemic. Dr. Ujay Blackstock, thank you so much for joining us. Please stay safe. Have a great weekend.
Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.